Introduction to the toolkit, to give you a bit of an idea about where it came from and how it came to be developed. As an OT, I've worked with people with MS, actually pretty much since I qualified in 1982, so that's a very long time. But I'd always seen people really with high levels of disability until 2001, when I started seeing people who were newly diagnosed and who were still working and were raising concerns about both their future at work or just their performance, or actually were having problems already. And this was an entirely new area for me. So as a responsible health professional, I went and looked at the literature and was sadly disappointed. The articles that were there were basically saying what the problems were, which I already knew, although it quantified it and gave me some context. It wasn't necessarily saying, so why don't you do this? And there were only a couple of articles that had actually talked a bit about intervention, and they weren't quite relevant to UK practice because they were set in North America, which has different health and social care structures and ways of dealing with vocational rehabilitation. So I had this idea that actually it would be quite useful to try and understand the problems that people with MS have in the UK, trying to give us some, if you like, more local understanding of difficulties, and find out what health professionals were doing. I wanted to know whether it was just me not knowing, or whether there were OTs out there doing some fantastic, innovative work, or MS nurses, or even DEAs out there doing things that should actually be known about and published, perhaps in some way. So that led to the first study. And at that time I really did also want to think about what might be possible as a way of improving practice and support to people with MS, but had no idea what shape that would take at all. It was an unknown quantity. And so through the course of doing that first study, it became quite clear that healthcare professionals often felt intimidated by work issues or felt ill-equipped to deal with them for various reasons. And actually that was mirrored by the experience of people with MS who found that they often didn't get support that they felt was helpful from health professionals at the right time. And they also had a great deal of difficulty actually even finding out what support was available to them through standard statutory agencies like DWP, Job Centre Plus, etc. So it sort of percolated that actually there were lots of different areas of difficulty, unsurprising, with MS. And so the idea of the toolkit began to form over a period of time. And because MS is a multifaceted condition, shall we say, with lots of different aspects and very individual, but also work is in that same frame. Nobody's experience of work is the same. Even two people doing the same job can have very different experiences because of their prior knowledge, background, and their experience of the work environment that they sit in, whether they're happy in that environment or not. So we've got two very individual things, and therefore it seemed you couldn't just have a one-size-fits-all resource or response to that. You needed something that would try and help meet different needs for different people with different issues going on for them at any one time. And thus, that's how the toolkit came about.